All right, welcome everybody. Thank you for joining us for the MVC Health in Action Work Group. It is April 5th, 2023. Today we are joined by a guest presenter. Today's guest presenter is Misty Cuellar-Coir. She is the Director of Quality Improvement and Organizational Excellence and Infection Control at McLaren Flint. And before I get everything started, just a quick little introduction about Misty. She began in the quality department as a data abstractor for multiple Blue Cross Blue Shield collaboratives and completed her bachelor's in nursing in 2017. As her career advanced, she moved into clinical improvement and patient safety roles throughout the state of Michigan. Her overall goal is to be a change agent, not only for patients, but also for healthcare staff across the state. In 2019, she used her passion and became a director of quality, patient safety, and regulatory affairs for a 158-bed community hospital. There, with the help of a great quality team, they advocated and became more present and increased their communications and celebrated all of the great things that their departments were doing. With that activity, they were able to successfully change their culture from believing that their roles were specific to poor outcomes to a more reactive and proactive approach about all of the work that they were doing within their organization. So with this background, Misty has successfully made some wonderful quality improvements and launched a wonderful event that she'll talk more about today. So thank you, Misty, for joining us for the work group. We just have a couple housekeeping items to review, and then we can get going on your presentation. All right, so as usual, this session is being recorded. The slides and recording will be shared with attendees and registrants following the work group. We will be monitoring the chat throughout the presentation, so feel free to add questions there. Also raise your hand using the Zoom function. And then afterwards, we do ask that you complete the post-work group survey. We'll provide the link in the email that will be sent to the registrants and attendees afterwards. This allows us to review your feedback and make sure that we're best serving you, our members, and other stakeholders. Okay, and then here's a little bit more about Misty. If you want to go over this, Misty, I'll send it over to you to let me know when you want to advance the slides and we can get going. I really appreciate you joining us today.
Thank you, and thank you for having me. I'm very excited to be here today. So this is just a little bit about myself. So, I really have always had a passion about making a difference in the lives of others and their families. I started working for a different hospital system back in 2011, and I knew then that it was going to be my work home for life. So I was a data abstractor, and I did multiple collaboratives, as Chelsea had said. And then when I got my degree, I applied for various roles for both clinical and administration or administrative work. And I landed as a clinical improvement coordinator working under the director at a pretty large Detroit hospital. And there's where I really learned a lot about quality and then patient safety. So as my career advanced, I started to take on more, challenging roles. In 2018, I became a patient safety officer, where I realized how important it was to continue on with my passion for helping others. It was a very busy role. We worked hand in hand with quality. I think we're the same. We have different roles and responsibilities, but we work closely together. And I knew then that I really wanted to be a change agent, not only for our patients, but for the staff. When things happen, we need to support our teams too. So the boots on the ground are really important. In 2019, I decided to apply for the director of quality at one of the sister hospitals that I was working for. There was a director of quality, patient safety, and regulatory. It was for a 158-bed hospital. And there is when I decided that after all the years of being in quality, I was like, we're too quiet. We have got to do something about making our voices be heard, letting people know what we do, and actually really letting everybody know what they do, because it's really about their work and how well they do. So we wanted to do something different, and at meetings where I was at before I just wanted to be loud and make sure that we were always talking about something that we did in quality, and all the great touches, how we help prevent harm, how we try to be proactive, and we're also working reactive, on that retrospective way. So we really got present on the floors and started to increase our communications and celebrate the great things that all the department was doing. Because I think sometimes we get stuck in that funk where we're always looking at the poor outcomes, and that's what we're going over. But really, we do so many more great things than there are those things that go wrong. So with that, we were able to build trust and have those collaborative relationships with staff, and we had such a great time. And so when I came here, that was like my number one goal is I wanted to make sure that I built a good relationship with the various leaders throughout the organization. I didn't really know a whole lot of people here, and so it was important for me to go out and talk with people and meet them, gain some trust, and I knew that through that, that's how we can get our work done. So and I want to make sure that we did a good job of educating our teams on what we do, how we're there to support them in the patient care, best practices, how it's important that we take care of each other so that we can be successful for the communities we serve. Okay, next slide. So what about quality? So my fear, I wanted to make sure that everybody knew what we do every day. We don't just have a duty or task. We don't just have one responsibility. We do everything, and we are everywhere throughout the whole hospital. I wanted everybody to know why we do it, and we do it not just for our patients, but so that we can show again how the staff what they do, how what they do affects our patient care, our numbers, and so I thought it was a great way again to celebrate them. And I wanted everybody to know who's responsible for quality. We're all responsible for quality, and not just the quality in the department, but everybody, everywhere, every department: food, nutrition, EDS, nursing, everywhere. We all have something to do with quality, and then I think I've meant to put why is it important and why quality is important in here. So those are some of the things that I really wanted to take away from this quality fair. I wanted other people to take away from this quality fair. Okay, you can go ahead and next slide, please. So the objectives I had was to provide a visual that incorporated quality and safety into everything we do. So who was involved? I had asked for various people to be involved. I first sent out an email asking who wanted to be involved because I didn't want to force it. I wanted this to be something fun, and for people to show the work that they do. So security was involved, which their table was a big hit. Patient safe handling. So we had Waddles and Busby, and you'll see some pictures later of that. So that's the safe handling team. They were really fantastic. We had education here. Patient safety came, did a board. Infection control, their boards were a hit also, very, very busy. Quality was myself, I did like Leapfrog and National Patient Safety Goals. And then the quality team, they put together their boards for their quality initiatives that they did. So the coordinating representatives from those CQIs also came and supported them. We did sepsis board, and then we had a falls committee member who they came and they did a board. And Michigan Valley Collaborative, they were kind enough to come and sit there with us all day. And we also had employee health. So putting this together was a lot more probably difficult than what I thought it was going to be. I started planning this probably 3 months before it actually took place, and which probably wasn't enough time. But I wanted to do it, and I was bound and determined, like this is going to happen, and I'm going to do this. Well, not knowing who many people were in the organization because I was new, I was trying to get marketing involved. So when I did finally get them involved, they were kind enough to help out, and that was really what made a difference. And I think next year, when I get to talk to that, I'll talk about that a little later. that's going to be where we'll probably have more of a better turnout, even though we had a great turnout this year. It's going to be very helpful. So, and they're very excited for 2024. So, next slide. So why a fair? So I was new to the organization in May of 2022, and as I said before, I really wanted people to know me and know what my objectives were, what my passions were, and my team. It's really all about the team. They do such great work, and I want to be loud and be their advocate, and I want people to know, you know, how hard they work and why we do the things that we do. I wanted an opportunity to educate our staff from all departments throughout the whole hospital on all of their great work, and also try to get some, you know, support and feedback and participation, asking people, you know, what could we do to help them? Did they have any ideas? We also wanted to show that what we measure and what we report and their hard work, and celebrate them. We also want to encourage nurses seeking alternatives to bedside care about the vast opportunities that they can pursue. So there's more telenursing than bedside care for those who are ready to move on or maybe make a change in their careers. Who was invited? So we invited all of the employees from Flint Hospital. So every single department, they were invited to the fair. Obviously, quality and infection control employees from all the McLaren sites I invited, and then many of the coordinating center members from the CQIs that we participate with were invited. So, and I just thought it was important that, again, you know, we wanted to make sure that everybody knew that quality lives everywhere. Everyone has ownership when it comes to quality, whether it be nursing, laboratory, EVS, food and nutrition, etc. So we were just trying to make sure that everybody knew that what they did was quality. Everything's about quality. Slide. So the goals for the fair were, of course, to, again, introduce ourselves to all who attended, educate and encourage collaboration and feedback, to have those coordinating center representatives available to the departments and physicians so they could answer any questions and introduce themselves and let them know how they are here to work alongside our team. So all of the coordinating centers that we work with have been fantastic. They were all more than willing to come and attend this fair. I think they were super excited to be a part of it. And they stayed for quite a few hours. I was so very appreciative of that. And then we wanted to show our progress and areas for improvement. And the target was to get at least 150 attendees. So it was a success. We had over 200 attendees come. And next year, I'm hoping it's going to be more. Next slide. So this was our flyer that we did. Marketing kind of put it together. It wasn't everything, but for like food, we did food. We had Donna's Donuts, which was a big hit. I'm not from around Flint, so I was told that if I say Donna's Donuts, that we have a lot of people coming. So that was a big thing. And they went. We actually pretty much got rid of all of them. I think I ordered 150 donuts, and they were all gone by the end of the day. And then drinks and treats. And so we played lots of games. We had candy. It was actually a lot of fun. So here's our flyer. It got distributed through email system, and then there was some postings around various departments. So hoping to do this again sooner when it happens this year. Next slide. So here are some pictures of our fair. The top left was we had some hand hygiene, and then it was our AGIS training and our security tables. That and the one in the right bottom corner also. The dog legend was a big hit also. He was our, I think everybody wanted to pet the dog all day long. It was really entertaining. So these are just pictures of the team. The bottom left is infection control. They were a hot table back there. They had lots of action. I think those are some residents that are there talking to them at that point. Next slide. again, just the pictures you can see in the top left where we had Busby come in as patient safe handling, teaching how to, she was needle stick, and then we had the duck that was walk like a duck, and for patient safety. We had a video that also played about what was important for, what did quality and patient safety mean to you, and it was really great because we had the CEO of the hospital send me a video, and then we had the CMO of McLaren, all of McLaren, send his video. So we opened with our CEO, closed with him, and then we had some really fantastic people who offered to do the video. It was just a couple minutes long, but it was really impactful, I thought. So next slide. So these are just, again, some pictures of education, our HMS boards that we had up. Did some needles. This is employee health table and patient safe handling again. Next slide. Here are some of the boards that we did. We had our marquee, our Class C board, patient safety did their board, and they had a really nice, fun little game to play as far as, you know, what needed to be reported. It was like a little quiz that they did. And then our Falls Committee board, which I'm a part of the Falls Committee, and we've done a lot of work and had a lot of fun with that. So these are just a few of the boards. We had quite a few. I ended up having to bring in more tables. There were so many people who came that brought a lot of boards, so it was really fantastic. Next slide. And then here's just some fun pictures of us at the end of the day. At the end of the day, we were just kind of having fun, and then National Patient Safety Goals and Leapfrog score. So trying to just let people know where we fall and what we're looking at. Right. And here's our quality and infection control team. So it's really kudos to them. They've done a fantastic job and worked really hard on making this work, and was really a great day. Bye. So what we're going to do different for next year is, this year we did a 12-hour day. So we did from 6 a.m. to 6 p.m. thinking that we were going to capture, you know, those midnight people. But where we had this held in the auditorium is not where the third shift people will pass by. So again, that comes down to marketing. So we're hoping to get marketing involved a little sooner, and this can be posted, and people will know about it and to come down there and visit us. We gave away prizes, and that was a big hit. So next year, I believe we'll do something different as far as time, whether we have like a midnight crew come in and do some stuff during the nighttime, or we kind of change it to, you know, more in the middle of the day to late in the evening, so we can try to get some of those third shifters in there. I would like to have unit-specific performance improvement projects, one per department. So kind of take that focus off of what we're specifically doing and look at the units and departments and see what they're doing and how we can help them, how we do help them. I also like to have a senior leadership table, like meet our chiefs, and not to stay down there all day, but I think it's really important that people come through and they shake hands and meet our leaders here and get to know them. Presence means a lot. I'd also like to get physicians and residents to participate. And we did have some physicians and residents come through. They were very excited, and I think next year they could do some great things too. We work a lot with them and have a lot of projects going on, and so I think that'll be a great thing. I'd also like to do a great catch board or boards. We have so many great catches throughout the year, and it's just nice to be able to celebrate all the great things like the staff do. Not everybody gets to see those, and not everybody knows, you know, that somebody caught somebody from falling and prevented harm. Those are just great things to talk about. And then next year, I'd also like to do food trucks because everybody loves food. Food and prizes was our big thing. So, but it turned out to be a great day. And again, next year, I'm hoping for it to be even better. That was the last slide. Does anybody have any questions?
I can start us off with a question. I know we had talked about this directly, just you and I, but could you share any, feedback that you received from individuals about the quality fair? And then have you noticed or did you hear anything about outcomes following the quality fair? Like, are there any new projects that people are thinking of or have implemented since this took place?
So yeah, actually, the feedback, I get really good feedback, especially from a lot of the physicians that came and attended. They were super excited because this hadn't happened in quite a while. I don't know, I don't know if it was 10 years or so, but it's been a little while since this had occurred. So they were very excited. But yes, like specifically with sepsis, we have a lot of stuff going on with sepsis, and this is kind of brought to light, hey, we're making movement, and now it's, the residents and physicians are really interested in how can they be a part of it too, which they already are, but what more can they do? But yeah, we've got great feedback, and I think there's a lot of people that are excited for this to go on again next year. We are.
That's great. Is anyone on the call? Oh, go ahead, Christy.
Sorry, I have a quick question. So have you thought about like the time of year that you do the quality fairs? Like, do you think you'll change, doing it at a different time, or any other thoughts around that? Because I know this year it was the end of January, correct?
It was beginning of February.
Beginning of February,
Yeah.
okay.
Yeah, we talked about that too. We're thinking that we're definitely going to do something more towards when it's warmer outside. And so that way, for parking reasons, getting those third shifters in, it'll be nice for them to walk from where we're at to their vehicles. And then again, the food trucks, if we could get food trucks, I mean, it would be hard to go out when it's raining and snowing. Yeah, it was pretty cold that day. So but yeah, we would like to do it probably more around summer or early fall. I know there's quality week, but I kind of feel like I don't want to do that during quality week. I'd like to do something different. So yeah, probably when it's warm.
Has anyone that's on the work group participant list today, have any of you guys attended a quality fair like this at any of your organizations, or heard of one taking place, or thought about starting one?
Hi, this is Irene, and I would say yes, yes, and yes. Pre-pandemic, the team that was in quality at that time, we used October 12th, and had this department involved with highlighting their initiatives that they worked on throughout the year. And then, so we had our front lobby full of poster boards that were just up for the week. And then there was criteria to meet for certain requirements so that they could be voted on. And then the team that won, everybody who participated in that initiative, that's I think 8 hours PTO or something like that in there. It's a pretty significant purpose. And then pandemic came along at the same time as turnover in our quality department. So for last year, we were just trying, again, very similar to you, Misty, like this is who we are, and here's what we bring to the rest of you and how we support you. So we did that and just trying to get our names out there. We started making sure we're grounding more regularly because our office is outside to make that connection. But we actually been starting to plan. We hope to be officially planning by June what we're doing in October. So I appreciate hearing you say, yeah, I gave myself, I think it's 3 months and that wasn't enough time. I'm like, oh, good note. Okay, good thing we're setting the plan now. So yeah, some of that this is really helpful, and just to know it's all right, we're not alone in what we're trying to achieve, and I just really appreciate it. So thank you.
All right, did you say you're doing it during quality week, or when is your fair?
Yeah, that's what we've done before is try to highlight it, a bigger push during quality week. And that was what we were planning on keeping with right now. I think this year I'll probably still do that, but I like that thought of maybe trying a different time of year too, because then you still can circle back and highlight quality again and everything that's being done. So you can kind of get a 2-for-1 by doing it at a different time.
I thought it was important to do it at a different time just for, just for trying to get ahead of like leapfrog and, what we could do better and focus on in those areas prior to the surveys coming up. And just kind of throw it in there because it is every day. And for me, for Quality Week, I really want to focus on celebrating the quality team and then those quality committees that we have, like, and doing more fun things and not have an all day long thing, but just like little things that go on throughout the week. Try to do something a little different for Quality Week.
Yeah, it's really interesting that, Irene, you guys were able to use the PTO's incentivization. So I was curious to see the different incentivization methods that are used at the different organizations.
Yeah, and then we would, and then winner would be announced at the Christmas, Christmas party type thing. But so trying to see if I can bring something like that back again too. I don't know if it'll be this year, but I'm hoping.
Yeah. Can anybody else speak to their experience with similar events or opportunities?
As excited, Lisa, you've got a basement.
This is Marlene. Great presentation, Misty. I love this idea. Can you tell us about how long did it take to put this together?
It took the full 3 months to get it organized. Like I knew what I wanted to do. It was honestly, I think that it hadn't happened in so long, and there's so many new people that I don't know that there was the believability that it was going to happen. And so it took me a little bit of like pleading, like, okay, wait, I've already ordered the food. We have all these prizes, and they were giveaways for things. And I'm like, this is really going to happen. And so I think, yeah, those 3 full months, it took a lot of work. And then especially like the last month, it was really, really busy. So I would recommend that, yeah, you take it's a 6-month process building and getting your boards ready and coming up with the fun ideas to get people to come, because honestly, you have to have something that entices them. Like I said, the food, the games, the raffles, that sort of thing. It'll bring them in, and where you place them also strategically is also important. So because you want them to walk past your board, you want them to see things and not just go straight for the food or games. So you want them to read the things that are on the boards and participate in some of the things that were going on, like the Busy Bee or Buzzy Bee, and then the Sharps. We had people practicing drawing up insulin with the new insulin needles, that type of thing. So you want people to actually participate. But yeah, I would say 6 months. Next time for me, I'm starting 6 months. 6 months ahead of time.
Thank you.
Yeah, I will say the layout that you guys had, the facility, was really nicely supportive of that round circular walkthrough, which is not something I've experienced at other quality fairs or healthcare research fairs before. And it was a nice change to be able to see the different opportunities. So that was a first for me. I know that's not the case at every facility, but it was a nice change.
Thank you. I was fortunate enough to have some really great people help put that all together and arrange it and try to figure out the best way for it. So it worked out nice.
Misty, this is Shannon from McLaren Central, and I wanted to hear about your fair. So awesome. That sounds awesome. Sammy said it went really well. But and I apologize if I didn't hear you talk about this, but did you have anyone from like electronic health records or Cerner lead or anyone there? Just because when we audit, we look at a lot of documentation and I don't know.
We did. We had a table, it was education and then some informatics where they were able to come, and it was a show us how you do things type of table. So show us how you document because of the new Cerner system. So that'll be something though for our next quality fair that we will definitely focus more on. And I would like to do something with the physician side of it also. But yes, we did do that.
Awesome. I kind of want to push for something like this. And I just feel like a lot of quality can only be proved through documentation and in whatever system you have. I know there's a lot of, barriers and lack of education from the staff. So I kind of wanted to do something with a combo.
Yes, yep, it will work. It works. And also, just it's kind of maintenance too, sending reminders out. We've created some little tools, S-bars and did you knows to help staff out with little snips. So really trying to help in that department also. But yes, that was one of the things that I really pushed for, was hoping that informatics could come and do that, show me how you do this kind of thing. And I think people won a piece of candy or candy bar or something for showing them. So
Awesome.
Anybody else? Any questions or experiences? Curious from an operational perspective, is there a specific budget that was assigned for this, or how could departments be supported in participating or initiating an event like this?
So for this, I really honestly just went to finance and said, this is what I want to do. Is there something I could be reimbursed for? Because I paid for everything out of pocket first, and no matter what I was doing it, I didn't care. I wanted this to happen, and I wanted my team to shine, and I wanted everybody to know what they did. And but yeah, they were very supportive, and actually I got the go ahead to just do what I needed to do for it. So it really didn't cost a whole lot of money. I mean, honestly, I think the donuts cost probably more than anything. They were really expensive. But then the door prizes that we had some really great prizes, I thought, and people really enjoyed that piece of it all. But the rest of it was really, the boards, putting the boards together, and candy and that sort of thing. So we kept it kind of low cost. And then we had food and nutrition pay for the food or the food and drinks. It came out of my budget, but yeah, I got the okay from it. I think because I think it does such a good thing for the hospital, and it brought so many people together, and just did a lot of teaching of what we do. I feel like in quality and patient safety, people see us coming and they're like, oh no, they're gonna give us more work to do, or something happened, but that's not really what we're here for. Like I said, we need to get away from that and teach people what we're really here for. We're here, number one, for patients, but number two, to take care of each other. I say that all the time, and it is about the organization too, but we're here to take care of each other. How can we help you be successful? Because if you're not being successful, then there's something wrong with the system. There's something wrong with how we're teaching. We've missed something. So how can we help you?
Yeah, definitely want to reduce the barrier to participation and entry and support everyone. And I liked what you said when we talked about the planning for it was, like you were kind of saying just now, there are so many initiatives that are ongoing at healthcare organizations, and there's a lot of different initiatives regarding patient safety and changes to operations and standard operating procedures and protocols. And this really speaks to the reasoning behind that, and educating, all levels of staff and all areas of staff about the true purpose behind it, and not just saying you do this because we said so, but this is why
Right.
we're doing it. Yeah. Yeah. Very
Well,
valuable.
it's funny. Where I went to school, where I went to college, while I was in college, I was already in the quality department. So it was, there were some things that were really like, oh, okay, this is easy. I knew the back end of nursing before I got to the front end of nursing. So it was super helpful. And after I left there, I've always been very close with my professors and then the dean. And they have me come back, and I always do a session with the new nurses and talk about, all the opportunities in nursing. It's not just bedside. There's so many things that you can do with nursing, and some people want to be with patients. Some people like, again, the back end, but I think the back end really needs to be taught more in our education piece when we're going through nursing school. And so where I went to school at Chamberlain, they actually changed their curriculum in their leadership class, and they focused more on a lot of the things that I gave my speeches on: regulatory compliance, Joint Commission, CMS, national patient safety goal stuff. I mean, I kind of went through a lot of things that were really, I thought, important that, some of us that have gone through school, we didn't get that piece in school. I mean, if we did, it was like a week long of a talk, and then we were done and moving on. So, but I think it's so important for nurses to be successful, to know the back end of it, the whys. Why do we need to do this? Here's why, and why we have to take all these steps. You have A, B, C, and D. You have to complete. You can't skip C because there's a reason for it. So, but yeah, they changed their curriculum for that leadership class, and I guess it's going very well. So excited for that.
That's awesome.
I have another question, not really specific to a fair, but since you're making it clear that you want to be transparent and get your face out there, how involved are you in any kind of new hire orientation? That's a new way to capture people.
That is actually so funny you asked me that, because it's been a topic of conversation for the last couple of weeks for me, asking, since COVID, orientations changed for everyone, I think. Where I came from, we had, a week, it was orientation for a week, and it was everybody. It wasn't just nursing, it was PCAs, it was EDS, it was everybody sitting in the classroom. And we got to come up, and we had time slots. So we had a fall education 20-minute, presentation. We had our core measures presentation. We had our patient safety presentation, infection control. So we were up there throughout the week at various times, going over things, introducing ourselves. We had business cards, and we always, it was nice to talk to people who came from other organizations, because they have good ideas, right? They have different visions. It was great to have new nurses come on, because let's just face it, they knew the new stuff and we don't, right? So we would try to, get them at that front end and build that relationship, so they didn't, have that same perception of us that, the people who've been at the hospital for a long time did. So we would try to, interfere right away and get our names out there and say, hey, if you have something that you want to work on, come and talk to us. We'll work on something with you. But that is something I think that needs to be brought back to nursing orientation. It's missing.
It absolutely does. And I think everyone agrees with that. It's kind of went away, and it's really unfortunate. So I just do a sepsis presentation. I kind of took it upon myself for a goal. And I think quality could have a piece again for sure. So thank you.
Yeah, thank you. Good question.
All right. Any other questions or comments for Misty?
So if anybody has any other questions that they think of or would like help or anything, I'm more than happy to share my phone number, my cell phone, my email. I don't know if we can put that up, but I can send this out to Chelsea and Christy, and they can send it out to the group. I'm more than willing to lend an ear or an idea or here to help.
Yeah, I can certainly CC you on the email to all the registrants when we send out the presentation and everything. And that way people can get a hold of you with follow-up questions. Yeah, we definitely want to encourage collaboration among members and, ask questions, pick people's brains. That's what we're all here for. We all want to improve healthcare across the state. So thank you, Misty, again, for sharing your expertise and your experience in this area. That really was a great event, and we appreciate your invitation to participate and share more information about the MVC with McLaren Flint.
Yeah, thank you so much too for coming. We appreciate it a ton.
Yeah. All right, well, on that note, thank you all again for attending today and for your questions. If you would like to reach out to Missy, you're welcome to do so in the follow-up email. We do have an upcoming chronic disease management work group that will be on April 20th with Gleaners Food Bank of Southeastern Michigan. And then we also have a collaborative care, psychiatric collaborative care presentation on increasing access to high quality mental health care and supporting providers on May 11th. The registration link is on our website. It's also going to be linked in the slides after send out. And always feel free to contact us at Michigan Valley Collaborative of med.umich.edu if you've got any questions or if you have any ideas for future work groups. You can email them to us, or like I mentioned at the beginning of the work group, you are welcome to submit any thoughts and questions you have over our work group survey that's also sent out afterwards. So thanks, everyone. Thank you, Misty. I hope you all have a wonderful rest of your day, and we'll talk to you guys later.
Thank you so much.
Thank you.
Bye, everybody.
Bye.
Bye. Thank you.